If you have a pelvis, you have a pelvic floor, regardless of whether you have a penis or a vagina. When I talk about the pelvic floor, a lot of people don't even have a clue what this means. People also don't realize that they can get help for things that they're being told are normal when in fact they're not normal at all. They're just really, really common. And today we're going to talk about what pelvic floor physical therapy is, what the pelvic floor actually is, what can happen, and what conditions pelvic floor physical therapy might help you with. So stay tuned. Welcome to Fearless Fridays, where we are talking about everything health and wellness related. My name is Dr. Melissa Chofi. I am the owner of New Quest Physical Therapy, a mobile practice serving areas in New York and Connecticut. There is so much misinformation out there in regard to the medical field, and with our healthcare model increasingly putting profits over patients, you as consumers need to be given all the tools you need to demand what you deserve, ensuring a strong, resilient, fulfilled, and fearless life. My goal is to empower all of you to stand up for yourselves and be able to call BS in a realm that is overwhelming and confusing. Let's get into the episode. So what is the pelvic floor? When a lot of us hear core, we think automatically of abdominal muscles. That's only part of what your core is. So your core is the abdominal muscles in the front, your lumbar muscles in the back, and then your pelvic floor as well. So I'm going to show you a pelvis. This is a female pelvis, and this is the front. Vagina is here. The acetabulum is here where the legs come down, and inside is your pelvic floor. So all of this in here is muscle, and it is your supportive structure. So a lot of organs sit in here, and just thinking of that, if you have organs sitting in this cavity here and those muscles are supporting it, it's a no-brainer how important these muscles are and how important it is to be able to engage them appropriately. So as we age, just like anything else on our bodies, our muscles may get weak if they're not being used. Our ligaments get lax and all of that stuff. So this is why pelvic floor, being aware of the pelvic floor and what it is, and strengthening those muscles or lengthening those muscles, we'll talk more about that later, why all of that is so important regardless of whether you have a penis or a vagina. Moving forward in today's episode of Fearless Fridays, I specialize in women's health, so we're going to be speaking about women's pelvic floor. There are options for men as well, especially if you're going through treatment after having prostate cancer and you're having urinary incontinence. There are options for you. If you have any questions about that, please reach out to me. I do have some resources for you that I would love to get you in touch with. So moving forward, we're going to speak about women's pelvic floor today. The crazy thing is pelvic floor physical therapy is very new in the medical realm, where a lot of MDs and OBGYNs don't even know that it's an available option. And I find that mind-boggling because in Europe, women, especially after giving birth, are referred to a pelvic floor physical therapist without any questions asked. So we're kind of behind the ball in the US with all of this, and the only way we're going to bring awareness is to educate, and that includes doctors and you guys as well. So I really like speaking about this because it's awesome for all women, and they don't even know it's an available resource beyond surgery. A lot of OBGYNs and MDs might even suggest surgery. I had a patient who she had an episiotomy 6 months ago, and she's having leakage, and her OBGYN referred her to a surgeon to perform surgery on her. And she goes, well, I want to see a pelvic floor physical therapist. And her OBGYN was like, well, what is that? And she was just blown away that this person didn't even know that we exist. So knowing that we are a resource for you, it's a very conservative measure, is really, really, really important. So you need to advocate for yourselves. So what type of issues can pelvic floor physical therapy help with? And the first one, I love talking about it because a lot of women don't know that this is not normal. It's just common and they're being told it's normal, is peeing your pants with activity, laughing, or sneezing or coughing. And I hear women all the time laughing about this and joking with their friends, when in reality, is it really that much of a joke because you're wearing a panty liner or a pad for the rest of your life? I know I don't want to do that. I'm sure most of you don't want to do that. And it's actually very, very, very common, especially in older women and especially in women who have had children. that their pelvic floor musculature gets weak and they're not able to engage the muscles appropriately, and that is what is causing, partly of what's causing the leakage, and it's not a normal thing. So it kills me when people are being told to live with this and they don't need to if they see a pelvic floor PT. I'm actually giving a talk about this at the end of the month, and I'll give you guys more details on that at the end of the show. The other thing that pelvic floor PTs can help with is organ prolapse. So like we were saying before, the pelvis is like a bowl, a supportive bowl for your organs. And when that supportive musculature weakens, organs can drop down. And you could see this like coming down from the top of the vagina or coming up from the bottom of the vagina. And the way I describe this to patients is like, if you feel like you have like not used tampon, but like a tampon that's been in there for a while, there's a heaviness, there's like a weighing down, like you feel like you're being brought down. That's what organ prolapse may feel like. A physical therapist may be able to help with that depending where you are in the stage of prolapse. Another thing we can help with, which is the opposite most of the time, is pain with sex. So just like I spoke about before, muscles in the pelvis get tight just like muscles in your calf or your hamstring. So when that tightness occurs, the vaginal penetration can be very difficult, and that's what causes pain in a lot of women. And rather than it really, really grinds my gears when I hear somebody say that she went to her doctor and was given a dilator and told to just use it, because it's not that simple. There's a lot of work that goes into working up to that point. So this is a very, very big option. I really get sad when women are being pretty much told to settle for less when it comes to their sex lives. We all deserve to enjoy sex, and this is something that pelvic floor physical therapy can help with. We can also help with after you've had a C-section. So what happens with the C-section, the scarring comes, and I mean they just cut through your not your muscles, but like your anterior. So of course things are going to get tight. You're going to have compensations with how you move, with how you're going about your day, with your breathing. So we work on, with the scar, we work on the stability again. You basically have to relearn, and especially after having a baby, you have to relearn how to engage your body appropriately. I mean, so when you have a baby and the baby's sitting, it's pulling your pelvis anteriorly. And what happens is a lot of those muscles get elongated or not used efficiently, and we can help retrain that. It also drives me crazy when women are being told to go back to normal activity after 6 weeks postpartum, and it's not that easy. You don't just jump back into CrossFit after having a baby. You need to re-engage all of those muscles, and I think that part of the reason why there are so many complications with returning to activity without some kind of problem like the urinary leakage or anything is because those muscles that have been used and the hormones that are in your body that have caused laxity in your ligaments and all of that, those issues haven't been addressed. So you can't just jump right back into activity after having a baby. That's just my 2 cents. And then finally, what we can help with is what's called diastasis recti. So it's very, very common in women who have born children that their abdominals separate. So again, pressure regulation, abdominal, like the deep abdominal contraction, pelvic floor contraction, all of that stability, we can help with all of that to help your body. I hate to say recenter, but I can't think of anything else right now, but help your body get back to performing optimally as best it can. To give you guys a little idea about what goes into a pelvic floor exam, for me, this is how I usually structure them, and everybody is different. It all depends on my patient and what she told me prior to the exam and what I feel like I need to address. So I'm very, very thorough in my examination because, like we were talking before, pelvic floor is one of the core pieces of your body. And that being the case, everything, your extremity movement, your balance, everything plays into that. So it's all an integral part of this major like body system. So I don't go right for the pelvic floor. I do a whole body assessment. So I'll look at your range of motion, especially of your spine and your hips, the strength of your muscles externally. So hips, like total leg, your abdominal capacity, what that looks like, what your endurance looks like, what your balance looks like. And then, if appropriate, there is an internal piece. So if clients are okay with me doing this, I will do an internal exam to make sure that their pelvic musculature is firing appropriately. There's a strong, like what the contraction strength is, what the endurance of those muscles is, if there's any tightness going on, if there's any asymmetry between left versus right. So ladies, after seeing this video, know that if you're having any of these issues and any of this sounds familiar, most likely your OBGYN is not going to refer you to a PT right away. So you really need to advocate for yourselves. We do have direct access in New York and Connecticut, which means that you can see a pelvic floor PT without a script. New York is 10 days or 10 visits or 30 days, whichever comes first. And Connecticut is 6 visits or 30 days, whichever comes first. So really advocate for yourselves and really push that you want to do conservative measures, because surgery and meds are being handed out way too often, and that's not getting to the core of the problem. No pun intended. But that's not fixing anything, because the core of your problem, where the sources are, could be a pelvic floor weakness or tightness or anything like that. So before you pull the surgical card, make sure that you've exhausted all of your conservative resources. I'm really, really passionate about this subject. It's why I went into my own practice. I feel that women are very underserved in this realm. There aren't many of us who do this. It's very rewarding to see that a woman avoided surgery because she sought help for pelvic floor PT. And now in 2020 even, we're so afraid to say the word vagina. We're so afraid to talk about sex. And that's really underserving us, because there are conservative options like this out there and available, but nobody talks about them. So just realize that this is an option for you. And I am starting to take free discovery calls. If any of this sounds like it would benefit you, please give me a call and let me know. I'll be setting up the ability to do that and schedule your own discovery calls on my Instagram. So it's Dr.Mel_PT. That's Instagram. So it's Dr. Mel PT, and I'll put it in the notes under here too. Make sure you book something with me down there, and we'll talk about whether I can help you. And I'm just really, really passionate about this, and I want more women to be aware of it. So make sure you're educating yourself, ask questions, demand a life you deserve, and most importantly, stay fearless. We'll see you next week.